Assalamualaikum. Welcome back. We continue with our lecture. The 7 medical masquerades that I mentioned just now. If you notice, these 7 diseases actually can present with many symptoms of many organs or systems. For example, diabetes. Is there any specific system that it is associated with? So then they can present with polyuria, polydipsia, weight loss, lethargy. So it can be non-specific. Depression. They can present with weight loss, lethargy, insomnia. Drugs. Drugs can present with many side effects from many systems. Similarly, anemia can present with lethargy, palpitation, fainting. Thyroid and other endocrine disorders also can present with many symptoms of many systems. The rest, like spinal dysfunction and UTI, also can present with many systems presentations. So, how to remember these 7 masquerades? Actually, of this lecture, there are only 2 slides that is important for you to remember. One is the 5 questions, the other one is 7 masquerades. Okay, I give you the mnemonic on how to remember. If you notice the 7 masquerades, there are 5 D, the letter D, depression, diabetes, drug, darah for anemia, and dysfunction of spine, and 2 T, the letter T, thyroid disorder and tract infection. So that is how I remember. Okay, we move to the next slides. Question 5. Remember, there are 5 questions that you need to ask yourself when you see a patient in a primary care setting. So question 5 is this patient trying to tell me something else? We need to consider this possibility if the presentations or the symptoms cannot fit with any of the obvious diagnoses, especially when the patient comes with unresolving symptoms or changing story, or the history does not tally with clinical examination. This patient may have other problems but too embarrassed to be frank to the doctor. For example, depression, marital problem, abuse, can be sexual, can be physical, anything that is sex related. For example, erectile dysfunction. So, this question usually you would ask at the end of the consultation or after a few consultations. You don't actually jump to this conclusion or ask about this possible diagnosis at your initial consultation, because it can be sensitive to the patient or it can be embarrassing to the patient. So, for this question number 5, the doctor needs to be sensitive on certain issues. Sensitive issues need to be addressed in an appropriate manner, and this will encourage patients to be honest and will lead to more open discussion. So, let's practice. Okay, let's say a patient comes complaining of headache for 3 days. How are you going to arrive to a diagnosis using safe diagnostic strategy? Remember, recap. What are the 5 questions that you need to ask yourselves when a patient presents with an acute symptoms? Number 1. Okay. This patient comes with headache for 3 days. Firstly, what you need to ask is basically the background of the patient. Okay? A 17-year-old student coming for headache for 3 days is probably have a different diagnosis compared to a 55-year-old man with headache for 3 days. So the background of the patients is important. Okay. If a 17-year-old student comes complaining of headache for 3 days, what is the most probable diagnosis? Recap. Okay, it can be tension headache. Yes, that is a common one. The other one, it can be migraine. Okay, any other causes? It can be headache related to any other causes. Okay, but of all these causes of headache, what is the most probable diagnosis? Probably tension headache. It's around the time of exam. Okay, but you should not also miss what if these patients have a serious disorder that I should not miss. Okay, so for question 1, the probability diagnosis, then you would ask of any stress, any coming exam, any personal problems. But when it comes to question number 2, what serious disorder not to be missed in a patient with headache, then you should ask symptoms of any intracranial lesion, that is raised intracranial pressure symptoms, such as, yes, early morning vomiting, any weakness, any blurring of vision. Okay, question number 3. What conditions are often missed or pitfalls? Headaches can be caused by so many things. For example, toothache can present with headache. Sinusitis can present with headache. Giant cell arteritis can present with headache, especially in an elderly patient. Question 4. Could this patient have one of the masquerades in medical practice? Do you remember the masquerades? The 7 masquerades, the 5D, and the 2 T's. So, could it be depression? Can depression present with headache? Yes. Could it be diabetes? Probably not likely. Could it be anemia, headache? Yes, headache can be a presentation of anemia. Could it be spinal dysfunction? Probably less likely. Could it be drugs? Yes, some drugs can cause headache. Could it be thyroid? Probably it's not so related. Could it be UTI? Probably not related. Okay, so it can be due to one possible cause that you should think of from the 7 masquerades is depression. Okay, could a 17-year-old student have depression? Yes. So following that, what you should ask is the symptoms of depression. Question number 5. Is this patient trying to tell me something else? With headache as a presentation, yes. After you have ruled out many other diagnoses or diseases, and you still cannot come out with a diagnosis, then you should consider number 5. Any personal issues, any abuse, it can be physical, it can be sexual, especially in an adolescent patient. Not necessarily, it can also happen in an elderly patient, but you still need to consider all these possibilities. So, as a summary, in diagnostic strategy in primary care, you have some problems in the sense that a collection of presentations or a presentation of symptoms can be shared by many systems or many specialties. So it is very important for you to open your mind to think of many possibilities, and to do that within a short time frame of consultation in primary care, it is a bit difficult. So what we are trying to teach you is use this diagnostic strategy model in which you should ask these 5 questions to yourself when you see a patient, and from that try to get the most probable diagnosis without missing any serious disorders or diagnoses that you may miss, and hopefully you can be a safe doctor in primary care. If you have any question, then we can discuss it in class. Thank you very much, student. I hope you understand and the lecture is helpful for you to understand on how to approach an acute symptom or acute presentation in a primary care setting. Thank you.